Today I want to go over the importance of how we're holding our breast to get a deep latch for our newborns. Sometimes we can have a lot of struggle with a shallow latch, one that's painful, bleeding, causing pain and cracks. I want you to keep in mind breastfeeding should never be painful. If you're experiencing those sensations, unlatch and try again. This is a learning process for you and your baby, so y'all have to work together. As your baby's learning, they're going to realize, oh, I have to open deeper. I have to get my mouth open a little wider so that they can get that deep latch. So I'm going to go over the football position as well. So what we're going to do, baby's tummy, we always want close to us. So if we're doing the football position, that looks like bringing baby around your body and having him where he's going to be nose to nipple. Why we want nose to nipple is so that way they can look up. Just like when we're drinking a water bottle, it's going to help them drink a lot more effectively. When we're holding our infants as well for latching, we never want to grab the back of their head because that can cause a lot of frustration and then pulling back and getting mad at us. Or sometimes it looks like breast refusal. So we're going to go ahead and bring our hands to their back. We're going to get our breast and nose to chin. Nose to chin. We're going to rub our breast from nose to chin. When they open wide, we're going to go ahead and bring them nice and snug in. If we loosen our arms, they can break that latch. Oftentimes I hear they'll latch on really great at first, and then after a few minutes, they just pop off. Sometimes subconsciously we're loosening our hand and our baby is getting further away from us. So to protect that, get your support people or get some pillows underneath your arm, just so that way you have a great support underneath you. There are a few tricks that I want you to keep in mind whenever you're getting that deep, comfortable latch. We want them to have a mouthful of that breast tissue. How can we get that mouthful of breast tissue? I want you to think about when we're eating a burger or a sandwich and we're getting a mouthful of that burger, we always are holding it above our nose. So what that looks like, I'm going to first show you what is common in how we're holding our breast and the difference of what we want to see when we're holding our breast, okay? So commonly I see we're holding our, let's say our baby's football. I'm seeing a lot of holding our breast in a taco position. It's going to make it very difficult for baby to get a deep, comfortable latch. Now I want you to see if we're holding like a hamburger based on where their nose is, they're going to be able to open wide and get a deep latch. So I'm going to show you a little bit up close. So this is that taco hold. They have their chin on the breast. It's going to make it difficult for them to have that full breast in their mouth, okay? So we make it a hamburger bite based on where their nose is. So here's their nose. They're going to be able to open wide. And they're going to have a mouthful of that breast tissue because they're not just feeding on the nipple. When they're feeding just on the nipple, it's going to cause lots of pain, cracks, bleeding, or it's going to make them work really hard to get to that milk. Think of it as if we're drinking out of a straw and we're biting down on that straw. We want them to have a mouthful of that breast tissue, okay? So by holding where their nose is, giving them a little room. We don't want to hold super close to our nipple because then we're going to be blocking where they're at. We're going to hold a little further back based on our breast size and chin, nose to nipple so they can open wide and get that deep latch. Now let's look at it from a different angle as well. So we're going to have our baby, ears, shoulders, and hips nice and aligned. So if we're ever seeing tummy in the air and they're having to turn their head, it's going to make it a little more difficult for them to get a deep latch. So we do want to make sure we're bringing them in, tummy to tummy, and wherever our breast is. So we're going to have their nose here. We're going to hold our breast either below or above so we can make that hamburger bite. If we're holding our breast like this, it's going to make that C shape and they're going to be unable to get that latch in a cross cradle position. So their nose is here. We're going to do a U or an A upper hold. So we're going to go nose to chin, nose to chin. Wait for them to open wide, and you bring them nice and snug. They're always going to choose breathing over eating. That's why another reason why we don't hold the back of their head, because if they need to, they're going to pop off all on their own. But if you're ever concerned, just sliding them down just a little bit more is going to be able to help see their nose, okay? So let's go back to that football position as well, so that way we can see. So again, we're making sure we're bringing baby all the way nose to nipple, so it does look like they're all the way around your body. I think that's what can make it a little difficult once they get a little bigger, because they're so long. So really try to wrap them around your body. You're gonna get your breasts, and again, wherever their nose is where we're going to have our fingers holding our breast. So nose to chin, they're gonna open wide, and you're gonna be able to bring them nice and snug, okay? If we're doing a cradle just means you're holding them with this hand versus crossing your hand. So we're gonna go ahead and grab our breast, and you can go upwards, and when they open wide, you bring them nice and snug in.